take a few minutes for you to understand the anatomy of cervix. Now, in medical school, we all, we have a subject of anatomy and where the different parts of human body are explained. So for the sake of simplicity, I'll just tell that cervix is 2 to 3 centimeter long and divided into two parts. If I zoom it a little, okay. Now this part, which is called as ectocervix. So ecto means outside, endo means inside. So ecto is the part that is facing outside, that is visible during pelvic examination. And the endo is the one that is facing inside the body on the uterine cavity. Now understand this part. There is a zone which is called as transformation zone where the ecto and endo meet. Okay, so this transformation zone is where the cervical cancers originate. That is the reason we are emphasizing on the anatomy part, because we should know where it is originating, right? So this is the place where maximum cancers originate, and this is very much susceptible to changes with age, pregnancy, and hormonal status of women. There are different types of cervical cancer. 6 are the major types, which is squamous cell carcinoma, which is 70 to 80% of all cervical cancers. Next is adenocarcinoma, which is 20 to 25% of all cancers. There are other common types as well, but I'll just take up 3 of them here, like adenosquamous carcinoma, neuroendocrine carcinomas, and clear cell carcinomas. Now, just for the sake of knowledge, it is better to know this. Once you are able to detect what kind of cancer it is, the further treatment depends on that. That is the importance of knowing different types of cancer. Now, coming to the very important part here. What are the causes and the risk factors? Now, we all have read so much about this on social media, and there are so many portals where we already know that HPV, which is nothing but human papilloma virus. This is the primary cause of cervical cancer across the world, the most common and the most preventable cause. Now, you will be surprised to know that there are over 200 types of HPV viruses strains, but only 14 are considered as high risk for cervical cancer. Now, there are types HPV-16 and HPV-18, which are responsible for approximately 70% of cervical cancer cases globally. And out of that, 50% are HPV-16, 10 to 20 are HPV-18. Now, the infection prevalence of HPV is 80% of sexually active individuals will be infected with HPV at some point in their lives. So this is very important to know. And most of the HPV infections, like 90% of them, clear on their own within 2 years. So what is the risk then if they clear within 2 years? If you have a persistent infection with a high risk, so there are combinations, like you have to have a repeated or persistent infection, and the type of the virus strain that is infecting, that has to be high risk. That is necessary for development of cervical cancer. Apart from that, there are other risk factors as well, which is like smoking, a weakened immune system. So weakened immune system, now we all know that HIV leads to immunocompromise, right? So it has been observed that HIV positive women have a 6-fold increase in the risk of cervical cancer, and 2 to 3 times more likely to have persistent HPV infections. Another class of category of people who have a weakened immune system is people who are on organ transplantation, because they receive certain medications so that the organ doesn't get rejected. But then another side effect is that they have a weak immunity. In that case also, they have a 3-fold increase in size of cervical cancer because they are on immunosuppressive drugs. Now, another important thing to know is the long-term use of oral contraceptive is also one of the risk factors. Now, women using oral contraceptive for 5 to 9 years have a 1.6 times higher risk of cervical cancer, and 10 or more years have 2.2 times higher risk of cervical cancer. Multiple pregnancy also is a risk factor, and possible reasons could be because there are a lot of hormonal changes that happen in pregnancy, nutritional factors, and increased exposure of transformation zones. So like I said in the earlier slide, in the anatomy side, that transformation zone is very vulnerable zone. All these factors, they directly impact that transformation zone because it is very vulnerable to any kind of dysplasia. And all these factors like family history, other risk factors like chlamydia infection, in utero exposure to diethylstilbestrol, it has a potential to directly involve that part and lead to cancers. Now coming to the early and advanced symptoms, how do you know that because any woman will first have symptoms and then only she will have a doubt in her mind whether she could be having a cervical cancer or not. So the early symptoms of cervical cancer are abnormal vaginal bleeding, and this is the most common early symptoms. Now, what do you mean by abnormal vaginal bleeding? What do you call a normal and an abnormal? So, bleeding between menstrual periods, which is called as intermenstrual bleeding, that is 30 to 40% of women have this as an early stage cervical cancer. Bleeding after sexual intercourse, which is called as postcoital bleeding, it happens in 50 to 60% of cases. And postmenopausal bleeding. So if a woman has attained menopause, that means she no longer has normal menses, and still if she's having a postmenopausal bleeding, that is a very important thing not to ignore. And in older women, it is 20 to 30% of older women present with this kind of symptom. So bleeding might start as a light spotting, but then over a period of time, it becomes heavier. Now the next is pain during intercourse. Medically, it is called as dyspareunia, and 30 to 40% with early stages of cervical cancer has this kind of symptoms. So what does it feel like exactly? Deep pelvic pain during or after intercourse, and it may be accompanied with bleeding also. Now, unusual vaginal discharge, 50 to 60% of women have this kind of a symptom, and the discharge could be watery, mucoid, or purulent. It has unpleasant odor and can be blood tinged as well. So always keep in mind, if anybody has the early, all these kind of symptoms, it could possibly be an early stage cervical cancer. It should never be ignored, and it should always be, you should always visit your doctor.